Hello and welcome to the Money Bear podcast. Today I have my friend on who actually reached out to me on Instagram. Ari and I have known each other for a few years now in the internet space because Ari and I met originally through coaching and then have just kind of kept in touch over the years. So Ari DM'd me, I want to say probably about a month ago when I was on like a rampage about the medical system and talking about my prescriptions and talking about all the stuff that I've been through in the last couple of months with like skincare and like stuff like that's just been a pain in the butt. And Ari's like, do you know about these programs? And I was like, no, I don't. She's like, do you want to talk about them? I was like, heck yes, I do. So Ari, welcome. I'm so excited to have you on the podcast.
Thank you so much for having me.
Heck yes. Anyway, so Ari is a pharmacist and has been a pharmacist in Southern California for a few years. And in the couple of years that she's been practicing, she has just been pretty blown away by the lack of awareness of some of the programs that are out there in terms of patient care, patient assistance, financial assistance for prescription drugs. And so she's going to help us kind of shine a light. She's not an influencer. She's not somebody that you guys can go follow or anything like that, which I think is really cool because, we've just got a expert in the space who's a practicing person out in the field. So I really appreciate you taking the time to share your knowledge with us today because not a lot of people have access to pharmacists where they can have this candid conversation.
I'm happy to be here. Yeah, I wish we could talk to more patients about these things. It's just so hard to find like the space where this is like allowed.
Yeah.
So that's really like, one of the barriers.
Yeah. In your first couple of years of working as a pharmacist, what has been some of the biggest surprises to you in patient care and prescription access?
It gets so complicated because what you can get, what your doctor can prescribe you and like that you can afford is based on your insurance.
Mm-hmm.
Right? It's not based on what the doctor thinks is the best medication for you. It's not based on, medical need for the medication necessarily, because your insurance will say, well, we prefer these, XYZ medication. So you have to try these. And if they don't work for you, then we'll consider next steps.
Which is so infuriating, isn't it? Where it's like, if your doctor thinks that you could be much better on another drug, well, if your insurance isn't going to cover it, they're not going to recommend it because they don't want you to, go. I mean, some of these drugs can cost thousands of dollars, right?
And the thing is actually also doctors don't always know what's covered by your insurance, right? Because there's so many insurance companies, they all have a different formulary, meaning like the list of medications that they'll cover. They'll tell you like, this is tier one, meaning like generics are pretty much free. Mm-hmm. But then as you go down, then you have like the non-preferred generics, then you have the preferred brand and the non-preferred brand. And it just, goes up from there. And there's, every insurance has a different formulary. So every patient that comes into the doctor's office gets, different preferred medications. And it can be really difficult to keep track of if you don't have somebody who like knows what's going on.
Right. And most of us who are getting prescription drugs or things like that, we have full-time jobs. We have maybe children. We have other things that are going on in our lives. And to navigate the system sometimes feels like this game where if you don't figure it out correctly, which it's very difficult to figure out correctly, the potential loss is thousands of dollars all the way up to potential bankruptcy. Not necessarily in the prescription space, but definitely in the healthcare space. So it truly is wild. So to kind of help navigate our conversation today, and first I just have to say, if you guys are listening and you are like, yeah, I'm so frustrated by the medical system, I hope it's affirming to hear from somebody who works in the medical system that, yeah, it is really complicated, even for somebody who works in it every day. I hope that's affirming to know that you're not failing, like you're not the one who's at fault here. It's a very complicated system. But because there's so many different ways this conversation can go, we're going to do something a little bit different today. And what I did is I pulled up a couple of articles where I just searched, like, what do you do if you can't pay your medical, or what if you can't pay your prescription costs? And I wanted to talk through these with Ari and see what else she's aware of that we maybe don't know about or maybe aren't in these articles. So we're going to go ahead and dive in. So the first article that I pulled up is at nhhealthcost.nh.gov. You guys can tell I don't pull up articles all that often. So essentially the New Hampshire healthcost.nh.gov. And so the very first tip was kind of like yeah, of course, is see if you can get a generic. So I feel like that's like the most common no brainer. Have you ever had an experience where somebody wasn't aware that there was a generic cost, or where somebody was like, oh no, I have to get the one that my doctor prescribed? Or do doctors generally prescribe the generics these days?
So generally doctors will prescribe generic or like allow it to be substituted. So maybe they'll write the brand name, but you can fill it for the generic at the pharmacy. You do have some patients who are like, no, the brand one is the only one that works for me. It's like, well, okay, that's fine, but you're going to have to pay for the brand name, unfortunately. And they don't usually like that.
Interesting. Have you ever tried to like talk through their reasoning on why they specifically are like, no, it's only the brand name? Do they just truly believe that's the only one that works for them?
They usually believe that's like the only one. Sometimes there are, because a generic medication has the same active ingredient, right? The same medication in it, but there may be different like filler products to make it into a tablet, or there may be different, there might be this instead of that. So like the inactive ingredients may be different. And some patients swear that like this particular manufacturer doesn't work for me, or this particular like one. And sometimes if you change the color or the shape, then they think that it's a different medication. It just, yeah.
That's like interesting.
It's kind of like a mental thing, I feel like, most of the time. But there is the whole, like, inactive ingredients are different or could be different. So there is like a little bit of like, well, maybe.
Yeah, that does make sense. And we want to trust the patient and in their own experience of like, no, I swear this one works for me and the generic is not working for me. And the science behind it, like in your experience in going through pharmacy school and being a pharmacist, like, is it possible that is true? Like that for some people, because of those inactive ingredients, or because of like maybe just the mix, that it could potentially not work for other people if it's like the generic versus the brand name?
It is possible. I would say, you could ask the pharmacy to order a different manufacturer, try a different generic. If you're trying, to get that like cost savings and not have to pay for the brand name because it is non-preferred, it is more expensive. You could try to see if they're able to order a different manufacturer for you to try like a different one, like a different generic, just to see.
Okay. That's really interesting and good to know. I never would have even thought of like, let's just try a different generic. In my brain, I would think there's one brand name and there's one generic, and those are my only options. So that's good to know. Now, the second tip that was on the list was consider getting your prescriptions through a mail order pharmacy. And I was like, that's interesting. I would have never thought that would be like a money saving hack. Have you heard or had any experience with a mail order pharmacy, or why that would?
I know a lot of, oh, sorry.
No, that was
chain pharmacies, are trying to like promote mail order, because then it's like a centralized fill, and then it's like they can like make have everything all in one place instead of having all these like separate chain stores with separate staffing and everything. So they may provide an incentive to order from a mail order pharmacy. However, you do have to remember that you have to plan ahead, right? Because it's going to take maybe 7 to 10 days for that medication to arrive. There might be a mail delay. If it's something that you need urgently, like an antibiotic, you're not going to want to wait for that. You know, you need it now. So for your maintenance medications, like your blood pressure, your diabetes, those kinds of like maintenance medications, it may be useful. It depends on, the insurance and the chain pharmacy that you're using, if they provide an incentive to use the mail order pharmacy.
Yeah. So it sounds like something that could be worth checking into for those kind of maintenance drugs, not necessarily something that you're like, I need it right now, because nobody's going to want to wait for their antibiotics. Like, yeah, I'll wait 7 days to get my prescription sent to me, depending on what the time is. It's interesting because I think about like when I've ever seen mail order pharmacy, I mean, Amazon now has like pharmacy and they've had it for a while. So I assume that it doesn't hurt to go quickly check and see like, oh, can I get this for a cheaper cost just by ordering it through Amazon if it's not urgent, or any other mail order pharmacy. The next one I relate to like GoodRx, because the next tip was look for coupons on the internet by searching for the drug name and financial assistance. I'm not sure if it's not exactly the same thing, because I know GoodRx is a little different, and maybe you can kind of help us understand what GoodRx is, which for those who are listening, I can't wait to talk about GoodRx because I feel like GoodRx is one of the coolest tools out there. But like going online to like rxassist.org or needymeds.org or patientassistant.com, pparx.org, and drugs.com to see if you can find coupons for your drugs. Now, my question to you, Ari, is one, have you seen this a lot? And two, if you're using insurance, can you also use a coupon? No.
So you cannot use insurance and a coupon. If you do the coupon, then you're going to end up paying like a cash price. It'll be discounted possibly because of the coupon, but sometimes your insurance will cover it for cheaper. So you want to make sure that you check, because they can run it through, like at the pharmacy, you can ask them to run it through your insurance and then run it with the coupon and see which one is cheaper for you. Yep. Because just because it's a coupon doesn't mean it's cheaper.
Right. Well, and that's what I do. So my insurance, as everyone who has been following me on Instagram or TikTok knows, is terrible. Like it's been terrible for the last year and a half. And luckily up until this year, I really haven't had to use it all that much. But one of the things that I realized, and I didn't even know this was a thing, that my past insurance, my insurance now is actual insurance that will give me like a prescription insurance cost, I guess, or coverage on prescriptions. But my last insurance, I didn't have a prescription coverage at all. I only had a discount card. So it was like, what I would do is I would go and I'd be like, all right, here's my weird insurance that no pharmacy has ever heard of. Can you look it up and see like what is the cost for us? And it's like, we're talking like I had to pay for basic stuff like albuterol, which like albuterol is usually pretty inexpensive, pretty covered.
Inhalers are actually insanely expensive.
Really?
Okay, albuterol is probably one of the cheapest ones you can get because there is a generic and it's made by a bunch of different manufacturers. But inhalers, for the most part, for like your asthma, your COPD, chronic obstructive pulmonary disease, they tend to be super expensive because they're brand name. They have a specific like method of delivering the medication to you, and that is branded. So you can only get the brand version of the inhaler. They are insanely expensive.
Like how expensive? That's crazy. I didn't know that. And I'm shocked because I don't feel like we talked about this when I worked at the American College of Chest Physicians. And like, I remember seeing all the different inhalers and delivery systems. And we never really talked about how like there just isn't a generic version, but that makes sense because I never heard of a generic version. So can you give us like, what's a price range? Like what can you expect for an inhaler?
I mean, on a good day, it can be like $47 per inhaler, and I've seen it go up to like hundreds.
And when you say on a good day, the prices change?
So, okay, well, I work a lot with older patients, 65 and up, who are on Medicare. And so there's this thing in Medicare called the donut hole. So like you get coverage, you get really good coverage until you hit the first number. When you hit that first number, that's called like going into the donut hole. And then your prescription cost, you have to pay, I don't remember the exact percentages, but it's something like, maybe like 75% of the cost of the medication or something. Like the price goes up that you have to pay until you hit the other end, right? Which like in a donut, right? The other end of the donut hole. And then the price drops dramatically and you pay like a fraction of the price, like 10%, 25%, something like that. I have to refresh myself on all the percentages and the numbers. Yeah. But I just know like once you hit that first number, it goes insanely up. And usually patients can't afford that insane price. So they never get to the other end of the donut hole where it drops dramatically.
That's insane. Like, why?
So why, like, there was a plan, I think, to restructure Medicare. So the whole donut hole thing is like getting revised, and they're putting limits on how much per month you can be charged for your insulin and things like that in terms of the Medicare space. Yeah. No, but that's only for patients 65 and up.
Right. Or disability,
saying,
right?
Like, on a good day, 47 if you're still like in that normal thing, and then up to the hundreds once you hit that donut hole.
Which is just like so infuriating because it's like, especially when we're talking about like life-saving drugs, like if you have a chronic lung disease, if you've got asthma, if you've got any of that, inhalers are not like optional. It's like these are life-saving medications. And the fact that you cannot reliably understand what it's going to cost you on a month-to-month basis, especially when you're in retirement, and a lot of people in retirement are on like a fixed income, that's just so messed up. It's so messed up and so infuriating. So, okay, because we got on, I was like, all right, where did this begin? I'm like, all right, we got on the
You were
side.
talking about your
Yeah.
albuterol inhaler, and I was like, hold up.
You're like, let's talk about this because, well, and what's crazy too is I can only imagine with COVID, more and more people are going to have long-term lung issues. Like I've never had albuterol before, but I had it because of my long COVID symptoms. And it was like, I think it was only $47 or something, but I used GoodRx. So back to the tip that we were originally on. And when I brought up the inhaler, so coupons, you can use a coupon if you're paying cash, but you want to check like maybe that's going to be a better deal for you. Maybe it's going to be a worse deal for you. Is there anything else we need to know when using coupons?
No, that's pretty much it. Like, just know that like it's not on top of your insurance; it's in place of your insurance.
I do also want to ask just from like the behavioral standpoint of like somebody who's nervous about going to the pharmacy and asking them to check two different things. Like, do you guys do that a lot? Does that something that you find frustrating? Is that something that's totally okay and encouraged? Because like I always feel, again, the people pleasing millennial, I'm like, I can't have them check a coupon and my insurance or check my insurance and GoodRx. Like, is that pretty standard? Is that not necessarily frowned upon? Can you kind of tell us a little bit about that?
So my disclaimer is I don't work in retail. So I can't say on a day-to-day basis, if you know your local pharmacist and you see them, you're nice to them. Usually if you ask nicely, I would say they will be nice, they will help you. We're not mean people.
Mm-hmm.
I will say retail pharmacists are incredibly overworked.
Mm-hmm.
There is just so much that they're expected to do. There's quotas they're expected to meet for how many prescriptions to check and get out and vaccines, and they just keep adding on more stuff. So I would say like maybe don't go ask in the middle of the like after work pickup rush. Mm-hmm. Like if you're able to go, during a quieter time, maybe like the middle of the morning or like, later on in the evening, maybe not like right before closing. But when you have like, 20 people in line, they may be a little frustrated because, they're supposed to clear all these people. And like, if they have people waiting to pick up and stuff like that, they do have time limits. But the technicians or the clerks are going to be the ones checking the insurance for you. And hopefully your pharmacy is well staffed. So, it's not something that's unusual. I would say that I would think many people are checking these kinds of things just to see what they can afford. But again, I am not personally working in retail pharmacy, so that's my disclaimer.
Yeah, yeah. And I will say in my own personal experience in dealing with the shitty insurance that I had and have, in every scenario where I've had to have folks check, like, and actually this just happened a couple of weeks ago when I was getting my steroids for my poison oak rash. I was at Target and it was funny. She was like, oh, we literally just put in GoodRx. We don't even look at people's insurance unless the GoodRx doesn't come back as reasonable. And so I was like, oh, wild. Cause I was like, can you guys check GoodRx? They're like, oh, we already checked GoodRx. And I was like, oh, you didn't even take my insurance. And they're like, yeah, because GoodRx is almost always lower cost than insurance. And I was like, wow, that's wild to me. So that was an interesting experience. And then I also, when I was in Portland, I was picking up like an acne medication and I had it checked with my insurance. I was like, do you mind? Like, can you also check the GoodRx just to see which one ends up being a better deal for me? And they were all super nice. So I agree though with what you said of like, make sure you're being thoughtful, like you're going at a time where it's not super busy and, people aren't going to be upset because there's a huge line. So awesome. Now, would you put GoodRx under that category of coupons, or do you feel like that's like a separate entity in of itself? Because don't they like use like they have like the actual insurance like information in GoodRx? I feel like I'm not explaining this right. Ari, can you explain to us
I'm
first?
Not sure. I actually can't explain GoodRx. This is like the one thing that I'm like, I don't really deal because
so
again,
funny.
I deal mostly with like older patients, and so they're not using insurance. They're on the fixed income, so they either run it through insurance, or we start helping them to apply for programs like that tip was talking about. Like you have your patient assistance program, or you can apply for low income subsidy. Like there are programs, and so we just generally go to the programs for them. So I'm still like trying to like figure out like, okay, in this like younger generation space, where you're not under Medicare, like what's the best thing? And I feel like the best thing is probably GoodRx, but I don't know that I can explain GoodRx to you at this moment.
Everyone, you guys are about to witness a live Googling so that I can explain to you what GoodRx is. And I'm so excited to talk about this because GoodRx has been a lifesaver for me. I have been using GoodRx. It's an app that is free. And I believe it was founded by Mark Cuban, if I'm correct. Now I have to double check myself. Mark
Cuban actually, I think, has like pharmacy that he like started, and like he had the generics are like really cheap.
Yeah, he's doing a lot in the medical space, which I think is really cool. So it sounds like he does something similar. I don't know if it's specifically GoodRx. He has his own pharmacy called Mark Cuban Cost Plus Drug Co. It looks like,
Yeah.
which is an online pharmacy. It's clear that it's his instead of GoodRx. So GoodRx, it's almost like a coupon system, but it's not really a coupon system because when you use GoodRx, when you get the coupon in air quotes, they literally give you like a bin number, a PCN, a group number, a member ID. So it's almost like you're using, and I always wonder this when I'm going to have to like try and get the founder of GoodRx or somebody who works at GoodRx onto this podcast because I think it's so interesting. Because like whenever I use it, I'm like, am I using someone else's insurance to pay for this? Because it's like literally giving you these member IDs and these group numbers, but they're calling them coupons. So what's interesting too is like you'll get the different prices for your drug at all the different pharmacies in your area, which is really cool. So you can shop around and it's like something as simple as albuterol or, you know, Xanax or whatever it is that you're purchasing. You'll be able to see at all of the pharmacies in my area, here are all the different prices if I use this coupon. So it's a really cool free tool. So pretty much anyone I feel like should download it and use it because you can always check like, okay, here's my cost, but if I use GoodRx, here's my cost. So you can always compare. And almost every single time GoodRx, for me at least, has been significantly cheaper. Like my acne medication with my insurance was over $270. And then with GoodRx, it was like under 100. So, Ari, are you also Googling?
Yeah, sorry, I was looking on the GoodRx website real quick. So I was looking, it's like, oh, does GoodRx set medication prices? And they're like, GoodRx does not negotiate or set medication prices. For the coupons, the prices are negotiated between pharmacies or pharmacy purchasing groups, and PBMs are the groups that like partner with your insurance to tell you like what stuff is going to cost. So GoodRx partners with the PBM to display the contracted price at each pharmacy.
Interesting. That's very
cool.
So
it's not insurance. They call it a coupon, but they do run it through because they have the bin and the PCN and everything. So it runs through like insurance.
Right. That's what I was like, I don't know if I would like put this under the coupon area because it kind of is a coupon. And to be fair, when somebody uses a coupon, like from maybe the manufacturer or something, does it look just like a coupon? Not like you're not getting a group member and all that stuff?
I don't know because I don't work in retail. I'm sorry.
Okay. No, it's okay. I was just curious. So, all right. Awesome. So that's GoodRx. This is not an ad for GoodRx, but I'm a big fan of them. So everybody who's listening. Okay. Next on the list is assistance programs that can help you better afford prescriptions you'd need. So it sounds like there's a wide array of assistant programs, including like manufacturer programs, where you can literally call the manufacturer or go to the manufacturer's website, look for an assistant program, look for a coupon, things like that. Contact the maker of your prescription, or that's obviously that. Then one of the other things that they suggested was ask your health insurance plan about any programs available to help you get your prescriptions. And then it was obviously Medicaid, but looking at patient assistant programs, looking at pharmacy programs, discount cards, nonprofit groups. Now, Ari, I know you had mentioned that you had like specific tips and things that you think people or that people really do not know about. Does it kind of fall under this bucket of like these patient assistant programs?
Yeah, it does.
Okay, let's hear about it.
So patient assistance programs are available through the manufacturer for any of their brand name medications because they know they charge that price because it does cost them money to develop the product and test it and, you know, go through all of those layers before they can put it on the market. But at the same time, we also know not all patients can afford that brand price. For things like inhalers, like insulin, like, you know, you're talking about your life-saving medication. So what the manufacturers will do is if you Google the name of your drug, and this again only works for brand name, it's not going to work for any of your generics because those are already like the cheapest they're going to get. But if you Google the name of your medication and you can just put patient assistance program after it, I think Needy Meds probably has like, I think that's the website that has like a collection of all of these together if you want to just go to one place. But I like going directly to the manufacturer website. So for example, if we were to look up like an inhaler, right? If we were to Google, let's see, like a Noroellipta, which is a specific inhaler, and we do patient assistance program, due to their manufacturer website, patient assistance programs do have an income limit. So it's, only for people like those, and it may be different. It's based on how you file your taxes. So if you like are like a grandparent and you're living with your kids, you're not necessarily filing taxes with your kids, right? So you would be filing as like an individual, which makes you more likely to qualify versus if you're taking into like account everybody else's, income and, when you're not actually filing taxes with them.
Okay.
So you'll need to submit your proof of income, which again, for most of the people I was working with was their social security income. Then there's a section that your doctor needs to fill out, basically saying that like, I'm writing them a prescription for this medication because they have this diagnosis. They may ask for a list of like your other medications that you're on, which your doctor should also have. So there's a whole section that you fill out. You're saying, I agree, like I'm applying to this program. Here's my proof of income. I attest that I only make this amount of money. I'm not able to afford it, blah, blah, blah. You sign that part. Your doctor signs the other part. They'll fax it off to the manufacturer for you. Then you can call them to follow up. There will be like a phone number listed to follow up. But if you qualify, you should be getting that medication for free mailed to you directly from the manufacturer. If it's anything refrigerated, they'll usually send it to the doctor's office and you just go pick it up from the doctor's office.
Okay.
But, again, completely free if you qualify for this program.
And so if you qualify for it, do you need, like, let's say it's a maintenance medication that you have to take every month. Does it like give you qualification for a set period of time so that you don't have to like keep reapplying? Or is it like you have to reapply for it every time you need it?
Usually you can get it for the calendar year.
Okay.
And then you usually have to reapply again.
Okay, like when January. Your taxes have been filed or something along those lines. Okay, very cool. So when we're looking at these different options when it comes to patient assistant programs, coupons, and then of course there's also like pharmacy programs as well, which I don't know. Do you have any experience with pharmacy discount programs? Okay, so
Not really.
Okay.
Yeah.
So let me just, for those who are listening on WebMD, like I told you guys, we looked up some articles first so I could navigate this conversation with Ari a little bit more organized rather than just going on constant rants. But this one came from WebMD, which is about talking about getting medication free or getting a discount if you can't afford your drugs. And one of the things that I had never seen before was pharmacy programs. And so what this article specifically talks about is that sometimes small local pharmacies will have programs for people who need more affordable prescription care. And even these large chain pharmacies like Walgreens and Walmart offer prescription saving programs if you're willing to pay a fee. So it doesn't hurt to at least check with your local pharmacy to see like, okay, what kind of financial assistance programs do you guys have available and what is the cost? Is that cost going to be more or less than what I'm currently paying? So it may be something that's worth looking into. The other option is there are partnerships with community health centers that some pharmacies take place in. So it's called a 430B pharmacy. They're part of a federal program that lets them partner with community health centers to provide medications for free or at a low cost. So you can see some of these partnerships at like Albertsons, CVS, Rite Aid, Walgreens, Walmart pharmacies. Not all of them, but some of those big chain pharmacies do that as well. They partner. So you can always go ask, hey, do you guys partner with any community health centers? And then check out that community health center to see if you're able to get that prescription at a lower cost. And if you want to check out if a pharmacy near you has that type of community partnership with a community health center, the U.S. Health Resources and Services Administration website has a Find a Health Center tool that can help you find a health center that does indeed have that kind of partnership available. So again, that's the U.S. Health Resources and Services Administration with the Find a Healthcare tool.
Yes. And then I
Okay.
also wanted to add on, Walmart has a generic list. So there are certain medications that are on their list that you can get a 30-day supply for $4 and or a 90-day supply for $10.
Okay.
I think you still need a prescription, but you can have them run it through that program and get those specific medications for $4 to $10.
Oh my gosh. And what did you say the program was called?
A $4 prescription at Walmart.
Okay. Awesome. I love that. Fantastic. So there's lots of ways to find the medications that you need, hopefully at a price point that is accessible to you if you're struggling to get those drugs that you need. I was talking about how to find a health center that may have that kind of partnership with a community health center. So if you're looking for that, you can go to the U.S. Health Resources and Services Administrative website. So let me say that again. The U.S. Health Resources and Services Administration website. It offers a Find a Health Center tool that will help you find a health center near you that may offer you a lower rate on your prescription drugs.
So if you like take a look or you search your city and search for like a free clinic, so not all cities have this. I would say it's probably like the bigger cities, but especially if there's like some sort of like medical school, pharmacy school, dental school, near you, there are like specific clinics set up that they're run under a grant that they see patients under, the students will see patients under supervision of a licensed doctor, and then they'll have like a licensed pharmacist overseeing the pharmacy section. There's one in Riverside that I know of that goes every other Wednesday for people who cannot, afford their health care. And you can get your maintenance medication there. They run like labs and they do, like a full like pop-up free clinic every 2 weeks.
Amazing.
I think Pomona might have one also. I don't know that there's like a specific way to look it up like on a like search tool, but that might be something else to look into on like Google, just like your city and free clinic.
Just any kind of free healthcare clinic. Amazing. Do you know if there's anything specific that people need to bring to those clinics?
The Riverside one specifically, because that's what I'm familiar with, they don't require insurance. They don't require proof of citizenship. It is dependent kind of like on who's running it. Usually, like if you have that one, I think requires a COVID test or COVID vaccination to be seen there. But if they have any sort of like website about it, they should have like the requirements of what you would need to bring.
Okay. Awesome. Fantastic tip. I love that. And then the final one that was on the list that, because we've already talked about mail order pharmacies that you could check out as well. There's also nonprofit pharmacies. So some pharmacies are funded by donations and grants, which allows them to give free medications for people who are looking for support. So that's something you can always check out as well. If you are looking for a charitable pharmacy or a nonprofit pharmacy, you can actually visit the National Association of Free and Charitable Clinics website to find other nonprofit pharmacies. With the charitable clinic, it makes me wonder if maybe you could also find those healthcare clinics as well. So again, that is the National Association of Free and Charitable Clinics website to check out if there are nonprofit pharmacies near you, or it looks like clinics as well. So that's pretty much all we had in terms of the articles. The other thing that I feel like kind of goes back to where we were talking about financial assistance is also just nonprofit groups in general. So one is the Partnership for Prescription Assistance, which may help you pay for your prescriptions if you meet the requirements. The Patient Advocate Foundation's copay relief, and Accessia Health. So those will likely do a similar thing where they'll look at your income, they'll look at like your need, and then you may be able to get assistance through that as well. Now, I do think it's really fantastic that so many of these resources exist, but I can't help but feel frustrated that these have to exist. Like, why does it have to be so complicated? Our medical system has, and this is not, I'm not expecting Ari to solve this. I know she can't solve this, but like, doesn't that just frustrate you where you're like, why is it that we have 10 different like things that people can navigate through and try to figure out to, save money on their prescriptions, when couldn't we just like, I don't know, make a healthcare more affordable? It's so frustrating. I love that you're laughing. You're like, ha ha ha, hilarious. That will never happen.
I mean, there's just so many corporations and like systems that profit off of the healthcare system that trying to get this changed at this point is going to be like just such an uphill battle because they
Yeah.
are fighting to not have these things happen. And they have the
Yes.
money to make it happen because we're
Yes.
paying them, like.
Well, and that's the thing of like when I feel helpless sometimes, where it's like, I had someone trolling me saying that my suggestions were like too individualistic to really work for a larger scale. And I was like, but you do understand that's the only thing we have real control over is our individual circumstances. We do not have control over the government. Like, yeah. And even if we did, like with through voting and things like that, absolutely. I always am encouraging people to pay attention to their elections, local and federal, because that does matter. And that's the only way change is going to happen. But that change happens at such a slow rate that what are you going to do? Wait 10 years? Wait 15
And
years?
hope that the change
And
happens.
hope that the change happens? It's like you have to look out for yourself. You have to know what systems are available to you. You have to be individualistic in that way while also paying attention to the larger scope of the problem. So it's like, I feel like I have to recognize that it's so messed up that it's like, here's 100 different ways to save money on your prescription costs. But like, this is the reality we live in. This is the system we live in. And the only way to make sure you don't go bankrupt or aren't able to get your medications is to educate yourself on the options that are available out there,
So that you live long enough to see the change happen.
Hell yeah. That was beautiful, Ari. Damn. She was like, oh, I know exactly what to say right here. Yeah. Well, I really appreciate you coming on and sharing your knowledge. Is there anything else that we didn't cover that you're like, I want to make sure people are aware of this as well? Or any final tips?
I would say like I don't know that there's like a lot of these available, but if your doctor's office has a pharmacist working there, that's just called like ambulatory care pharmacy. And in California, we can work under a collaborative practice agreement with your doctor to help you, manage your chronic disease state. And those are probably going to be the people who should know more about like these kinds of programs to help you. Again, not all doctors' offices have them though. So that is, kind of a drawback. But like they'll have the time to like sit down and walk you through like the steps of this kind of stuff versus your pharmacist at the, at CVS, Walgreens, whatever is,
right.
They'll try to help you, but they don't have 30 minutes to talk you through all of these processes. Yeah.
That's really good to know. And even to going to some of these nonprofits and calling just to gather information, like they may also have more time to kind of help you navigate what your best option is, especially if you are in that dire situation. If you're just looking for cheaper access and it's not like oh my God, I may not be able to get my medications, I would think like your first tool is like, look at GoodRx, see if like that's such a simple, easy one that you can pull up on your phone in 10 minutes. Everybody should do it. And then what would you say like kind of the order of operations are is like, okay, GoodRx, easy lift, easy to see. But if you're like, oh, still can't afford it, what are kind of like the order that you would be like, all right, first you should do this, then you should do this. And then like last resort is this.
I completely forgot. You can also have your doctor's office fill out like a prior authorization or like a tier exception for you if there's a medication so for prior authorization, this would be a medication that they feel that you should get, and maybe you didn't do all of the steps that the insurance is requiring yet, or something that's not on the formulary, and they want you to be able to have it. So your doctor's office can fill out a prior authorization for you.
Okay.
The other option that I said was a tier exception. So say there's something that's like a tier 3, which is more expensive than your tier 1, but that's the only medication and it's not available in a tier 1. There's nothing in that same class of medication that's a tier 1, and it's like it's working for you. You can ask the doctor's office to fill out to like try to apply for a tier exception so that you can get that tier 3 medication at like a tier 2 or tier 1 cost instead. So that's another thing that you can try. Some doctors' offices may get sample medications from the manufacturer. Usually it's only like a 1 to 2 week supply, but maybe that holds you over while you're applying for some of these things. Those are the other things that I like completely forgot to bring up until this point. So thank you.
No, that's fantastic. And I love that idea too of just like, I think too, it's like being willing to get a little vulnerable with your doctor and saying, hey, I'm scared of being able to even afford this. Like, what if it isn't a drug that even works for me and I'm, spending a bunch of money on it? So being able to have that conversation and see, are there options available? Because I don't think a doctor's office, especially knowing how often our doctors are also overworked and also like very much understaffed and see like 20, 30, 40 patients in a day, they may not be upfront with that information unless you ask for it. So being able to say, hey, I'm really worried about costs. Can somebody talk to me about like what other options I have on these medications? So fantastic
because
tip.
it may not be them. It might be their MA or, you know, somebody that they have designated in the office to go over this kind of stuff. So yeah, exactly. So GoodRx, you know, you could try the PA, the prior authorization, the tier exception. Those will take a little longer. You can try asking for samples to hold you over while some of this stuff goes on. I would say like after that, I would try, if you qualify, try applying for those patient assistance programs because, you know, if you qualify, you get those meds for free for the rest of the year. Like, yeah, you have to apply again. You can, you know, you can even apply towards the end of the year for the following year, right? So you don't lose that if you know you qualify. So, you know, I would go there, like you try with the GoodRx first, and then, you know, you can also try at the same time through insurance to try to see like which one is going to be better. Like you're saying, run it through insurance, run it through GoodRx, and then, you know, trying the programs to see what you can qualify for.
Yeah, because we don't want you guys paying for stuff you shouldn't be paying for. So if you know likely you are to qualify, or even if you're just not sure, check, see if you can get assistance through the patient advocate programs, the patient assistant programs. We just were talking about that in our episode with $4, which is, again, if you guys have not watched the episode with $4 or listened to the episode with $4, I highly recommend checking it out, especially if you have any type of medical debt or medical bills, because like I just said, we don't want you paying for stuff that you don't need to be paying for, especially like when we're looking at programs. These programs are funded. These programs are there for a reason. So you should take advantage of these programs. So, Ari, thank you so much for your help in kind of laying out this stuff and explaining these systems because they are so complicated. You're very soothing. Like your presence is just so calming, and I appreciate you. I'm going to ask you two completely unrelated questions now that have nothing to do with medication and prescription drugs, but it's something that I ask all of my guests. So my first question is, what are you binging right now or obsessed with right now? Is there any like television series, book series, podcast series, anything that you're like really obsessed with right now?
I'm actually rewatching Madam Secretary on Netflix. I love it because she's just so creative and coming up with like solutions that are, you know, diplomatic, and her husband is so supportive. Her kids are great. Like, I feel like it's a very like realistic portrait. Like it's not like everybody's perfect or everybody's like very, what is it, like stereotypical, right? It's like, oh, like this is what a good like family dynamic could look like. So I love that about her.
Oh, I love that. Okay. Madam Secretary on Netflix. And then my second question to you is, what's your very first money memory? And I think we talked about this in coaching, but I can't remember it. So what do you, going far back into the recesses of your brain, can you remember what your first money memory is?
You know, I don't remember what I said in coaching either. Like, cause I don't know that I have one specific thing. I knew I was like, oh, Chloe's going to ask me this. And I don't know that I can like think of something super specific. I've been like thinking about it for the last 3 days and I'm like,
oh, the pressure's on. Oh my gosh, that's so funny. I mean, I've had people who have said like their first money memory was in their like teenage years or like their, you know, later on. And I'm always like, I bet if you like thought back farther, you might have a younger one, but also maybe you don't. And that's okay. Maybe that just goes to show you that money wasn't super present in your life when you were a kid. Or, I mean, if any of us have trauma, our memories suck. So
I mean, I just remember like being taught to save.
Yeah.
Right. And that was one of the things that I think I talked to you about in coaching, because I was like, my default is like saving, right? Yeah. Not investing or, you know, like all these other things that we need to do to manage our money, right? Yeah. Like I'm like hoarding it. Like it, I mean, I put it into like a high yield savings account, but I'm still like sitting on it. Like I need it there just in case.
Yeah. Yeah. And it's so many women who do that specifically. Like obviously men do it as well. But I feel like the people who I meet the most who are like, yeah, I just have like 30 grand sitting in my checking account. And I'm like, and the reason is, they're like, I don't have a reason. It just feels safe. I'm like, all right. Yeah. I'm like, at the very least, let's move that into a high yield savings account. But then we need to talk about like, how much do you actually need to have in cash? So awesome. Well, it was so good seeing you again. I just really appreciate you coming on and sharing your knowledge. This was really fun.
Oh, good. I'm glad. Thank you for having me.
Thank you so much for listening to the Money Bear podcast. If you've made it this far, do us a favor, take 2 seconds, rate, review, and subscribe. It seriously means the world to me. And if you just take a second to do that, I will appreciate you endlessly. And if you do, let me know on Instagram and I'll thank you personally. So, got that. And of course, since we were talking about anything financial on this show, please note that nothing on this show is intended as financial advice. I don't know you, unfortunately. And because of that, I cannot tell you what to do with your money. You got to work with a financial professional who knows your situation, who is preferably a fiduciary. And keep in mind that everything that we talk about on this podcast is for education and entertainment purposes only. It's all my opinion. So, there's that. If you want to see our full terms and conditions, head on over to the show notes. And while you're there, we've got free resources for you to get started on your money journey down in the show notes as well, including a free guide to help you with your budgeting templates and budgeting tutorials and investing 101, understanding the different accounts that are out there. All that good stuff is inside of my free guide, which is also available at thelazyinvestorscourse.com/guide. And if you're ready to take our relationship to the next level, also, I've got a free investing class that is available at thelazyinvestorscourse.com/webinar. We host it once a month. If you're ready to take our relationship to the next level, I am also hosting a monthly investing class. And that investing class, you can find the times we're offering it this month at thelazyinvestorscourse.com/webinar. That link is in the show notes as well. And that's where you have the chance to meet me live and ask those money questions live. It's a good time. We've had over 20,000 people as of recording this join or register. And yeah, it's always nice to meet you guys. So I hope to see you there. Again, all that is available down in the show notes. So thank you again for coming and listening. I appreciate you, and I'll see you next week.